Thank you, Dr. Hoffman, for joining us for the December 22nd media availability. The Lost Coast Outpost asks, can you tell us what is going on with the transmission type statistics on the county dashboard? In the past 30 days, there have been 770 new cases of COVID confirmed in the county. Over the same period of time, only 60 have been officially put down as due to contact or travel. Meanwhile, the number of cases listed as under investigation has ballooned up to 768, well over the number of known active cases in the county. How can the dashboard categorize only 14 more infections as being through contact to a known case between December 1st and now, when there have been some 70 cases related to the Granada outbreak over the same period?
Great question. Really happy everyone's looking at the dashboard and using it. We can clarify on this. So December 1st, we went to a state-based system called CalConnect, which is a way to really do the contact tracing and investigation in a much more organized manner. Of course, that training and transition period took away from some of the other work that we were doing, which included how we can track all this and put it on the dashboard. So my understanding is there's a backlog of those, like 600 some cases that we are working to get that information on. We know the information, we just have to collate it and put it in the right place so that we can put it on the dashboard, and that's being done over the course of the next week. What I'll say is that, yes, we know what the majority of our cases are. There's still, the vast majority are contact to a known case. There's still a smattering of travel-related cases, and certainly gatherings is another area we know that big majority of our cases are coming from. So look for that update soon. It's something we've been working on over the past week and going into the next week.
Thank you. The Lost Coast Outpost asks, what work does public health do to track the progression of disease in people actively battling the virus? What resources must you bring to bear in monitoring active cases? With the number of known active cases over 500, do you find that public health is unable to do this work to the degree that it should be done, or to the degree that it did previously?
Yeah, really great question. Encompasses a lot of what we do here at Public Health and what our role is in people with COVID-19. So our first role is really identifying the cases of COVID-19, and we get that directly from the state and the systems that track the laboratory results, and our teams contact the people who are positive for COVID-19. They interview them, and they find out about what sort of risks they have for spread of the disease. They also give them a lot of information about how they can isolate at home, who their contacts are, and also help defining the period that they were contagious and that they might have had contact with other people. And they give information about how they can get medical care. But I'll be clear that we do not provide any medical care to the cases. We do encourage people to seek out care from their doctor, or if they need to seek emergency services. The next part of it is really identifying the contacts and getting those people on quarantine. And we did used to do a lot more of that when the case number and the caseload was smaller. We have had to let go of that, and that's what, a little over a month ago, we started talking to people about this message that we're going to ask low-risk cases to contact their own contacts and give them information about quarantine. So that's where we're at right now. We continue to contact every case who has COVID-19, and we continue to give them information about COVID-19, about isolation, and about how to put their contacts on quarantine, and we look for contacts to high-risk settings. Thank you.
The Time Standard asks, what guidance has the state provided for vaccinating mortuary employees who have contact with COVID-positive bodies?
Yeah, I haven't seen specific guidance on people who work with COVID-positive bodies, but we do have guidance for the 3 tiers in phase 1A, and those 3 tiers do include in tier 3 laboratory workers. So I assume we will put them with that tier 3. We'll look into it and see, but I would put that in the same category as someone who works in a laboratory. So looking for that guidance, and we'll let people know if we get any more specific on it.
The Time Standard asks, how long is the deceased capable of passing along the virus after death?
I'll have to say I don't know the answer to that. I don't know that there's any studies or solid evidence about that. We do have recommendations for use of PPE with a body that's COVID positive, and all of those folks should be versed in that and should be using full PPE.
The Time Standard asks, are any other BRIAS facilities in Humboldt County affected by the outbreak at Granada?
So we don't know of any other outbreaks at any other facility by that company in Humboldt County. Many of our skilled nursing facilities and assisted living facilities have had a case in a worker, but have not resulted in outbreaks. So there are no other outbreaks in Humboldt County.
The Time Standard asks, have any Granada residents or staff received vaccinations?
No, they have not. We are working on a plan right now to begin the vaccinations there. Once the quarantine, their quarantine has passed, we'll get working on them and all the skilled nursing facilities in the next round.
The Time Standard asks, previously names of COVID-19 related deaths were released. Will further names be released at any point? If not, why not?
Public Health does not release the names of those deceased from COVID-19, and we have no plans to do so in the future.
Thank you, Dr. Hoffman.
Thank you so much.